Hello friends, let's understand about the care that we need to take after we do angioplasty and the patient is discharged at home. It is important to understand and take care so that we can get a good long-term results in the case of angioplasty procedures. Angioplasty is an interventional procedure. We need to puncture an artery either at the hand or at the groin and do the procedure completely. After that, once the patient is discharged home, we can expect some amount of bluish or blackish discoloration at the puncture site. It is usual, bruises are common, but we need to watch whether it is increasing day by day, whether it is painful and there is a soreness. If it is there, you have to report immediately to your doctor. There are chances of hematoma formation, though they are rare, but it is better we pick it up at early stage. Along with that, you need to understand the patient might have fatigue and weakness for a couple of days based on whether the patient had angioplasty after an heart attack or an elective angioplasty. So the patients do need time for recovery, which starts from at least 2 weeks to 6 weeks based on the patient's cardiac ejection fraction. Once the patient is at home after angioplasty, we need to understand the symptoms that patient should watch for. They can be alarming symptoms like recurrence of a chest pain or heaviness or acidity like symptom associated with sweating, fatigue, tiredness which is new in onset or increasing than the level it was observed while the patient is being discharged from the hospital. And if these symptoms are there, please immediately report to the treating hospital or the cardiologist who has done the angioplasty. So after angioplasty, the patient is at home. What activities we need to start? How? So in this regard, the activities should be started in graded fashion. Patient is advised bed rest for 2 weeks after discharge, but that doesn't mean the patient has to stick to the bed all throughout the day for those 2 weeks. It means that patient should not resume his daily routine activities in the office, but at house the patient can walk around, roam within the house, go to the washroom, use the facilities, and while doing this the patient should not exert. It should be done at slow pace. Once the patient feels better, then you start walking in a graded fashion. That means you start walking for maybe 30 minutes initially, slowly at your own pace. Once you feel comfortable, then you increase the speed day by day or every 2 to 3 days, and make sure that at the end of 1 month from discharge you are walking for at least 45 minutes and covering a distance of 4 to 5 kilometers without feeling the symptoms of tiredness, breathlessness or weakness. These are the activities necessary to remain fit over a long-term period. Along with this, lot of patients have queries about their intimate relationship with their wife or the partner. So in that regard, we advise based on the primary diagnosis of the patient, whether it was a heart attack or a stable angina, and what was the ejection fraction of the heart. If the patient is recovering well in the daily routine and is able to do all his walk for 30 to 45 minutes daily comfortably, then that is the time to resume the intimate relationships also. Many patients have queries about fluid intake to be taken at home. We advise the restriction of fluid only when there is a kidney problem associated with a heart problem or the heart pumping is very low, amounting to 15% to 20% of the ejection fraction. Then we advise the patient to restrict the fluids to 1.2 to 1.5 liters per day, which includes our water intake, the soups, the tea and other beverages. So including all liquids, the limit is 1.5 for a select few patients where there is a kidney problem and the ejection fraction of the heart is around 20 to 25%. Otherwise, we should respond to our thirst and take the water as per the daily requirement, and we can maintain a healthy intake of 2 to 2.5 liters for a patient who is not having symptoms of congestion due to heart failure. When we are caring for a heart attack patient, for the treatment, it is a teamwork. As a cardiologist, we do diagnose the disease, start the medical therapy which is appropriate, do the angioplasty if it is necessary, and discharge the patient in stable condition. After that, the responsibility of the patient and the family members start, which is very crucial, which is in the form of compliance to the medication. So, After doing angioplasty, the job is not over just by going home. We have to make sure that we are taking the medicines which are prescribed on a timely basis and continuing it without stopping. So you buy the medicines which are for a duration more than the next follow-up, so that the medicine stock is not over before the next visit with the doctor and the patient is not devoid of the medicines. So it is very essential that the medicines are continued, otherwise the chance of second heart attack after the angioplasty increases, especially if we stop the blood thinners. So there is a possibility that some patients might develop some side effects which may or may not be related to the medicines. Please do consult with your respective doctor and take a decision based on his advice what the medicines to be changed or modified or discontinued. All the diseases of heart which require angioplasty are chronic disorders. They are considered in the group of non-communicable diseases, and there is no permanent cure for these diseases. These patients need regular follow-ups and compliance to the medicines to keep the disease under control. It is possible in majority of the patient we can avoid recurrences by regular compliance to the medicine and follow-ups. Follow-ups are very essential for the doctor to understand whether the patient is responding in a right way or is he developing the side effects or no, and based on that we take a call to modify the medicines. In most of the case scenarios we need 2 blood thinners for at least 1 year after the angioplasty. We need to look for the side effects like bleeding anywhere in the body, which can be subtle, needs to be picked up during the physical evaluation of the patient on follow-up, and modify the doses based on the response and the side effect. So it is crucial that you turn up for the appointment as advised for the regular follow-up with the doctor. As I said previously, managing a patient of heart attack is a teamwork. There is a responsibility for the physician or the cardiologist, his physiotherapist, dietitian, and patient and his family members. The responsibility lies on the patient to maintain a good lifestyle after he recovers from the angioplasty and the heart attack and resumes his daily routine, so that the benefits are maintained over a long-term period. The lifestyle modifications include regular walk as a simple form of exercise or any other exercise which patient likes. It should be done at least for 45 minutes in a day and at a brisk pace. Second is proper diet. In the diet we have to reduce the calories from the refined sugars, which are maida, the white sugar, the jaggery, and other components which make a food a junk food, so that your food should be rich in the vegetables, fruits and salads, and less of oils, sugars and salt containing food should be there. Along with the diet exercise, the patient should stop smoking if the person is smoker. The alcohol should be reduced or avoided completely. Along with these things, patient should dedicate time to his personal hobbies, so that the mental status remains happy over a long period of time, and it gives us positive energy to maintain our lifestyle modification. Thank you.